Lyme isn't just one problem. It can involve infection, co-infections, inflammation, pain, fatigue, and brain fog. In this video, I'm going to explain why the best integrative Lyme strategy has 3 layers. Layer 1, antibiotics for pathogen clearance. Layer 2, sauna and herbs for immune support and recovery physiology. And layer 3, acupuncture for nervous system regulation. So if you thought Lyme was only about killing bacteria or that integrative care meant replacing antibiotics, then you're going to be surprised how much recovery depends on calming inflammation, restoring nervous system balance, and helping the body remember how to regulate itself again. The first layer is antibiotics for pathogen clearance. So antibiotics remain the cornerstone when Lyme disease is active. So doxycycline, amoxicillin, ceftin, and some in later neurological cardiac cases might require IV rocephin or penicillin as the conventional tools being used for pathogen-directed care. That's the foundation. The rest of the integrative model doesn't replace this layer. It supports the patient's recovery around it. Layer 2, sauna and herbs, is all about immune and recovery support. Right now, the human research isn't showing that sauna cures Lyme disease or clears Borrelia from the body, but what it does suggest is that repeated heat exposure may support circulation, immune resilience, pain regulation, and fatigue, and reducing the body's stress response. The best way to think about sauna is that it's going to create a controlled heat stress. The practical sauna protocol is this. So a dry sauna, roughly 176 to 212 degrees Fahrenheit, for 15 to 20 minutes, 2 to 4 times per week, if tolerated. Now that's important. So you want to start lower, build slowly, hydrate well, and stop if you feel dizzy, weak, or nauseous, or overheated. Also, remember, if you're pregnant, acutely ill, prone to fainting, or have any type of heart condition, please clear sauna use with your physician first. So while sauna isn't a Lyme cure, it belongs in the recovery support lane, helping circulation, immune resilience, pain regulation, and also stress regulation. The herbal layer is similar. Herbs shouldn't be framed as a replacement for antibiotics, and this isn't something that I recommend to patients self-prescribe because treating Lyme isn't about taking 1 or 2 herbs. It's complexity. It requires adapting a base formula to your symptoms and where you are in that infection process. Now, this part is mainly for acupuncturists and herbalists. So one traditional framework that can be helpful here is the concept of goo syndrome. In traditional Asian medicine, goo refers to hidden toxin-like pathogens that seem to lodge deeply in the system, and they produce a mixture of neurological, digestive, immune, and also emotional symptoms. So Heiner Fruehauf, a leading voice in goo syndrome treatment, has written extensively about this. And I'm going to be drawing from that broader clinical tradition while keeping this practical. Herbal treatment for complex Lyme recovery is not done in rigid stages. It's built as a layered prescription where different herb categories are emphasized according to the patient's dominant presentation. The clinician is going to adjust the formula depending on whether the case looks more acute or chronic, excess or deficient, hot or cold, inflammatory or depleted, neurological or digestive. Now, in that model, the major herbal strategies are disperse wind, clear toxin, tonify qi and blood, nourish yin and shen, and move qi, blood, and phlegm obstruction. The base formula I use as a starting point for this discussion is Su He Tang, with additions and subtractions, what we call Jiaijian. So it's made according to the patient's presentation. It's not a rigid formula, it's a clinical architecture. The sequence of emphasis is usually this. So first, open and mobilize what's stuck, then clear or attack the goo toxin and then move blood stasis, qi stagnation, and phlegm obstruction, while you're also supporting qi, blood, and yin enough to prevent collapse, but not so aggressively that we feed the pathogen. So layer 2 isn't about replacing antibiotics. It's about supporting the terrain around recovery. So sauna helps through heat stress to improve circulation, immune resilience, and fatigue and pain. The herbs help support the immune, inflammatory, digestive, and neurological terrain of the patient. And because this is individualized medicine, this isn't something that I recommend that patients do on their own. If you already have an acupuncturist or herbalist, please flag this section for them. And if your practitioner has any questions, they're more than welcome to contact me directly. The link to do that will be in the description below. Layer 3 is acupuncture. This is the regulatory layer. This final layer where we stop thinking only in terms of killing pathogens and start asking a different question. How do we help the nervous system recover from what the infection did to it? Acupuncture belongs in the regulatory lane. It's not being used to kill Lyme directly. It's being used to help the body recover from the downstream effects of Lyme, the pain amplification, the inflammation, the sleep disruption, fatigue, and brain fog. For acupuncturists, now my treatments begin by identifying the 8 extra meridian pair through Li Shen's pulse pictures. From there, I use facial Teishin treatment to stimulate trigeminal to vagus nerve signaling through the nucleus solitarius, followed by magnets on the face and ankles to open up those divergent channels and support efferent vagus nerve signaling. Then I do the root treatment. That's with the needles and ion pumping cords, according to that pulse picture. I add points from my 4 pathways model, depending on which systems are most effective. And then add symptomatic points based on what the patient is actually presenting with that day. In plain English, I'm treating 3 things at once: the constitutional pattern, the disrupted neurological pathways, and the patient's most immediate symptoms and concerns. The constitutional pattern, it tells me how the person's system is organized underneath the illness. The disrupted neurological pathways tells me which regulatory systems have been most affected, whether that is going to be the vagal autonomic balance, the spinal and brainstem pain signaling, the neuroimmune inflammation, or fourth, the regulation of the neurotransmitter networks that shape sleep, mood, digestion, fatigue, and cognitive resilience. The symptomatic points tell me what needs attention today. So if the patient is coming in with fatigue, brain fog, and neuropathy, joint pain, or anxiety, the treatment isn't going to be generic. It is built around the pathway that is most disturbed and the symptoms that are most active. The goal isn't to replace antibiotics. The goal is to help the body regulate pain, inflammation, sleep, mood, and digestion. At the end of this section, I'll show you 3 acupressure points that you're going to be able to activate with a toothpick on your own. So acupressure in this area here influences all 4 neural pathways, and it's what I like to say is the body's nervous system reset button. So this area just below the breastbone is where many people hold stress as tightness, shallow breathing, or upper abdominal guarding. We're not pressing directly on the vagus nerve, but gentle stimulation here can help soften the diaphragm, slow the breath, and send the brain a signal that the body is safe. That's why I like to think of this as a reset button. It helps quiet the internal threat signals so the body can move out of guarding and back into easier breathing, calm, and repair. So what we're going to be doing is looking for tender spots in through here, in through here. Here's the xiphoid process just around here. Here's the border of the diaphragm. So you're going to be poking along here. You find a tender spot. And we're going to be doing that spiral technique with the toothpick. And remember, we want pokey, not ouchy. We don't want to be breaking the skin at all. Just sending some neural signaling to the brain to help the body relax. So stomach 36 is one of the best researched acupuncture points for helping the body shift into a calmer and more regulated state. Now, in the context of Lyme disease, it helps support vagal activity, reduces inflammatory signaling, and helps balance neurotransmitters that are involved in pain, fatigue, mood, and brain fog. So how we're going to find it is, here's the bottom of the kneecap here. We're going to take 4 finger lengths down, finger widths, I should say, down. That's the level. And now here's the bone. You're going to go 1 finger length to the outside of that bone, and that's going to be where the point is. You can also think of it as, here's the bone coming up the inside of the bone, and it's kind of in that little cul-de-sac. And then what we're going to be doing is doing the toothpick acupressure in a spiral, like I've shown before. And remember, we want pokey, not ouchy. We don't want to be breaking the skin. And that's it. Okay, so this next point is large intestine 11. You can find at the end of the crease of the elbow. So it's right in through there, and then you look for tender spot. Here's the epicondyle, and so it's in between the inner border of that crease and the epicondyle, end of the crease. There you go. So I like this because it's used a lot for calming inflammation and regulating the body's immune response. For Lyme, I like it especially because people are dealing with inflammatory symptoms like joint pain, muscle aches, skin irritation, and body-wide immune activation. And so there's the crease. You go to the end of that crease. And then, like I've shown with the other points with the toothpick, you do it, remember, it shouldn't be ouchy, just pokey. You don't want to break any skin. And you do it in a spiral to activate the point. Now, this isn't Lyme treatment by itself. Think of it as a simple nervous system support technique, something you can do in between visits to help calm the body, decrease pain, and give your nervous system a gentle signal towards regulation. This is the role of acupuncture in this integrative model. So antibiotics address pathogen clearance. Herbs and sauna support the terrain of recovery. Acupuncture helps the nervous system remember how to regulate again. Now, if you're dealing with Lyme disease or lingering symptoms after treatment, the most important thing I want you to hear is this: you're not crazy, you're not weak. Lyme can affect more than just the site of infection. It can disrupt the immune system, the nervous system, and that's sleep, pain signaling, digestion, mood, and energy. That's why a comprehensive approach matters. So antibiotics are used for pathogen clearance when the Lyme is active. Herbs and sauna may support immune resilience and the terrain of recovery. And acupuncture can help regulate the nervous system, calm pain amplification, support sleep, and reduce stress reactivity. This will help the body shift out of survival mode and back towards repair. Now, this doesn't mean every patient needs every therapy. It means that the treatment plan should match the person in front of us. If the main issue is active infection, that has to be addressed directly. If the main issue is inflammation, fatigue, brain fog, or pain, well, then the body may also need help learning how to regulate again. That is the heart of integrative Lyme care. You're not replacing conventional treatment. You're not pretending that one therapy does everything, but using the right tool for the right layer of the problem. Now, if you're already working with a physician, acupuncturist, or herbalist, I hope this gives you a clear way to think about the roles of each of the therapies. And if you have any questions about how acupuncture may fit into your recovery or how I approach neurological cases and chronic cases, links are in the description below. Because the goal isn't just to treat Lyme. The goal is to help the person recover.